A very warm welcome, all of you, and a very good morning. It's wonderful to have all of you here today, and with an amazing success of the IFM Conference 2024. Um, we received overwhelming notes from all of you regarding the information, the insights shared by our esteemed speakers, and there was a dire quest to know more, and our speakers also wanted to share so much information. So here we are back again with some bonus sessions where again we want to share a lot of cutting edge advancements in functional medicine, which can help the practitioners here to improve their patient outcomes. So our first speaker for today is Dr. Thomas Lodi. He's a visionary in integrative oncology, and beautifully he blends cutting edge science with compassion to redefine cancer care. As the founder of an oasis of healing, he empowers patients worldwide to take charge of their health through programs like the Stop Making Cancer course. So today he'll be talking about biological dentistry. Before we get started with that, did you know that 80% of the systemic diseases are causally related to oral health? Did you know that microorganisms have access to the brain via cranial nerves? At least I didn't learn that in the medical school. Did you know that microorganisms have access to did you know that the occlusion of the teeth is functionally related to C1, hence affecting the entire spinal column, including the ANS? Moreover, the health of the tooth directly affects specific organs. All of this were taught to us in the medical school. So, and above all, we cannot say that we have evaluated a patient if we have not thoroughly evaluated the oral health. So if we are not looking into the oral health, we are missing a huge piece that can help us connect the dots as we work on identifying what are the potential root causes contributing to our clients' sign and symptoms. So here we have Dr. Thomas Lodi, who again keeps inspiring us with his amazing insights. And today he will be sharing a lot of information on biological dentistry. A very warm welcome, Dr. Thomas. Request you to please unmute yourself.
Sorry, yeah. Thank you very much for inviting me here. Yes, in fact, when I began to learn about oral health, I realized that, I was like shocked that I've been practicing all these years without that knowledge, and I feel it's to me it's almost malpractice. It's you know, it would be like somebody comes in for a physical exam and I examine everything except the heart.
Yes.
How can I say that I evaluated them? Anyway, thank you for having me, and I'm really happy to share this. And I just want to let everyone know that I'm not a dentist. I wish I was. I wish I had learned that. I really do. But I'm not a dentist, so I might make some mistakes. I've put together as much as I can without any formal training. So
Thank you so much. Over to you.
we get started?
Yes, please.
Okay. Here we go. All right. Where do I put this? How do I get rid of this? Anyway. All right, so we call it biological dentistry, and I think you might agree with me that I think we should take out the bio and just call it logical dentistry. All right. So I'd like to let you know that I've been working for the last few years with a Dr. Emma Abramayan. She's a dentist in California. Originally from Russia, born in Russia. Pretty smart lady, went to medical school at the age of 15. After medical school, she went to dental school. Then she did a fellowship in oral surgery where she actually put jaws back together on the battlefield. Then she did a fellowship in orthodontist, and then she did a very stupid thing and married an American, and she had to go to America and had to go to dental school over again. Anyway, after that, she started practicing, and she's the best. So anyway, she very kindly loaned me some of her slides that I think you'll see are very important. So, and just to let everyone know, she has agreed to train any dentists we can find in India who might want to learn this, because I think any dentist who sees this presentation is going to realize that they're missing out. They've missed out on a lot. So I would like to establish biological dentistry in India, and I think maybe we can do that by, I don't know, forming a healing center there, and in that healing center be complete. So we take care of the body, which of course includes the mouth, the mind, and the spirit. So everything from meditation to colon hydrotherapy to diet and to all of our interventions. We need to do all that. So we could bring in a biological dentist. Anyway, think about it if you have any colleagues who might want to do that. And let's get on with this. Okay, so now, whoops. There we go. All right. Now, approximately 70% of medical schools include only 4 hours of instruction, and while 10% offer none at all in terms of oral health. All right. Now, we all know that we didn't get any training in nutrition, or very little training in nutrition, and the training we got was wrong because it was the American Dental Association, which is, walking lockstep with the American Medical Association, which is a subsidiary of the Rockefeller industry. So anyway, in my second year of medical school, we learned how to do a physical exam, right? And what did we learn? The first thing you learn is the head. The head, ears, eyes, nose, and throat. HEENT. And we forgot about the O. We forgot the oral. We skipped the oral. And do you realize how insane that is? If you realize that the oral cavity, not only has teeth, and each tooth is actually an organ, okay, and all of its associated structures, including the gums, the periodontal ligament, the bone, and all that. We skip the related biochemistry that's involved in there. We skip the 9 oral microbiome niches. There's 9 microbiome niches in there, okay? We did look at the relationship of the diet to the size of the jaw, cranial anatomy, airway. All of that stuff has to do with biological dentistry. For example, right now, if a child goes to an orthodontist, they wind up pulling a lot of teeth because there are extra teeth. Why are there extra teeth? There are no extra teeth. It's just that what's happened is that over the millennia, because we are now no longer eating human food, and we're eating food that doesn't require chewing, our mandibles are actually smaller than they should be, and it looks like the teeth get crowded. All right? But think about the mouth. Being contiguous with the throat, it connects to the nares, the internal part of the nose where the air comes in. So it's connected to that. It's connected to the throat. It's connected to the gastrointestinal tract, and it's connected to the lungs, to the bronchial tubes. So that oral cavity is pivotal. It's in the center of everything that happens. All right. So we skipped it. We just overlooked it. Anyway, there's no way you can evaluate a patient unless you look at the oral cavity. Oops. There we go. All right. So biological dental medicine. Okay. So what it does is, in reality, it views the mouth as the gateway to the body, mind, spirit complex. Okay. And it integrates this with everything, which we're holistic physicians. We think that we're looking at the whole body, mind, and spirit, and we overlook the oral. We say, oh, we'll go to the dentist and get a checkup. Well, God forbid you should go to a regular dentist, because they're just as, I don't know, I don't want to insult anyway, but they're like we are. When we were trained in medical school, we were trained to uh, come up with diagnoses, and then we would have pharmaceutical or surgical or some other sort of intervention that was sort of a military approach. And that's what it was. It wasn't, we didn't learn how to integrate and restore balance. We didn't learn anything like that. Anyway, the goals of a biological dentistry are really the same as in regular dentistry, right? That's to maintain the strength and durability and the aesthetics of the mouth, all right? So the differences are this. Basically, fundamentally, it's toxicity reduction, okay? In conventional dentistry, there's not any attention paid to that. They put almost anything in the mouth. They put mercury, they put, which we know is extremely toxic. I mean, on tuna fish cans, it warns pregnant women not to eat too much tuna fish because of the mercury. So anyway, in biological dentistry, maybe the fundamental difference is in not putting any toxins in the mouth. But it's much, much more than that, and I'll go over that as well. So here's the scope of it. It's metal and fluoride free. We'll go over why fluoride free. It involves heavy metal detoxification. It attempts to always keep the tooth alive and to maintain the microcirculation rather than just extracting. Okay? Whenever it uses any material, and there are over 9,000 dental materials, it makes sure that they are biocompatible. Okay? It looks for infections that in conventional dentistry they don't even know exist. For example, in conventional dentistry, they don't know about what are called cavitations, which we'll go over. It's not even in their curriculum. They don't know it. They look at the x-rays and they don't see it. Okay? So they look for, in biological dentistry, they look for these hidden infections, the ones that are obvious and the ones that are hidden. They look at ankylosing, which is tongue tie, okay? And many people don't even know they have it. But that, okay, the frenulum is shorter and they don't really, people don't even know they have that, but they can't quite talk right. And anyway, it's something that's a biological dentist always take care of. And with a little laser, they can extend it, all right, without having to have any major surgery, but they do that. They look at oral galvanism, which we'll talk about, okay? They look at sleep disorders due to breathing, so they look at airway, okay? Root canals and endodontics. Endodontistry, if you're not familiar with that term, endo, inside, so it's the inside, the pulp, you know, where the blood vessels are, the lymphatic vessels, and the nerves are, okay, all of that. That's the endodontist. And what an endodontist basically does is he does root canal therapy, which we'll get into. And the cavitations are called fatty degeneration, osteonecrosis of the jaw. We'll get into that, okay? In biological dentistry, they address nutrition, lifestyle, relationships, and they balance the cranial dental sacral complex, which we don't even think about, all right? We know in functional medicine, we know that there are cranial sacral therapists, there are myofascial release therapists, because we know all of that's important. Well, in a good biological dental exam, they examine the cranial bones, and they can tell they're not cranial. They're not trained in cranial therapy. However, they're enough to identify it. And I've seen Dr. Emma take a patient and examine their heads, and then just do a little thing, and the person started crying. And she goes, "I didn't know that anybody could ever fix that. I've had this chronic problem, and no one ever believed me, blah, blah." And so I was like amazed, okay? And then she sent this person to an osteopath who specialized in cranial. So they were called a cranial osteopath. Imagine. So, and think about it, those 7 bones that you know, so that you can come through the cervix when you're being born, you have to have those 7 bones, and then they then fuse over time. But if they don't fuse exactly right, what happens? That means the jaw, the bite, your temporal mandibular joint is a little bit off. And if that's a little bit off, consider where the bite is. The bite actually is functionally C1, the top of the spine. And that is everything from your peripheral nerves to your autonomic nervous system and everything. And if that's off, you're in trouble, okay? They also look at the oral microbiome, and they look at the oral systemic link. So that's it. So really, you're going to a head physician. I mean, I don't know what to call them, but they're not. When I think of dentist, I think of just like a mechanic. They're way more than that. Now, so whole body dentistry should really be called whole being dentistry. I don't know how we got two professions. I'm still trying to figure out when the mouth left the body. What I found is that actually there's actual dental records and dental discussions back in Egypt before we even saw medical. So it seems that it's always been separate. It's kind of strange. I don't know how that happened, but it just did. All right. Anyway, so we're talking about this very important tube, the tube that begins at the lips and ends at the anus. That tube begins with the mouth. And that tube, if you keep it healthy and alive, you keep it clean, healthy, and functional, you'll live long and prosper unless you get hit by a truck. All right? So taking care of the tube is really important. And the first part of the tube is the mouth. Okay. Now, let's just think of what the mouth does. Not only do we get of our nutrients and our water, but what percentage of our breathing goes through the mouth? Maybe 30, 40%, it depends on the person. And psycho-emotional, right? We communicate with that. That's how we talk. That's how we, that's what makes us human, right? Is language, intelligence, right? That's what we call intelligence. That's what makes us human, right? We can bless people, we can curse people, we can do chanting, suatmon, we can do prayers. So the most horrible aspects of humanity, such as cursing, and can come out, but also prayers and blessings can come out. It's incredible. And the mouth also is part of how we communicate non-verbally, because we know that 90% of human communication is non-verbal, and a lot of that is the mouth. That's why when they were having during the recent the great hoax of 2020, when they were making people cover their faces, do you know what that was doing to children? If children grew up not being able to interpret the people they were talking with, the adults, not be able to interpret what they were communicating by not seeing their mouth and their facial expressions would have been a travesty that is incomprehensible. Fortunately, we got past that for now. All right. And so anyway, so the mouth, we cry, we laugh, we kiss. It's very, very important. Anyway. Now, the biocompatibility in conventional dentistry with restorative materials. They'll use anything. They call these amalgams silver. They're not silver. They're mostly mercury. They've got other metals and heavy metals, right? So they don't think about that. But the problem is that you wind up with a metallic taste. You get inflammation of the gum, actually deterioration. You get bone loss, tooth loss. You get these lichenoid lesions. It's incredible what these metals do, and I'll talk more about that. So what they do in biological dentistry is they take your blood and they send it to these special labs, and they test it against 9,500 dental materials. And even though, like, most people might not have a problem with a particular substance, you might have an idiosyncratic reaction. And therefore, let's not put it in your mouth, because it'll cause a chronic inflammatory low-level inflammation, which is going to be incompatible with health. So, and in biological dentistry, they look at cements, composites, bonding materials, everything. So it's very, very important, and that's overlooked in conventional. Now, mercury. Finally, January of 2025, the European Parliament is phasing out dental amalgams. Okay, it's just coming up right around the corner here, in a week, less than a week. Okay. So they finally are acknowledging that mercury does not belong in humans, okay? And what they're saying is that beginning January 1st, 2025, they're going to have, you must have mercury-free alternatives. Okay, that's what dentists must do, all right? But they're also going to prohibit the manufacture and export of dental amalgams to and from the EU. That's amazing. That's amazing. Because not long ago, dentists in America, at least, would lose their license for saying anything like this, right? They would lose their license. What's interesting is, think about it. The dentist is going to use mercury in an amalgam. So the mercury is brought to them in these hazardous containers. And when they pick up the scraps, in hazardous containers. So they've concluded that the only safe place for mercury is in the mouth. Madness, madness. So, and it's coming here. So in Bangkok in 2016, actually, the UN Environmental Program, they had a conference on how do we begin to phase out mercury in the Asia Pacific, okay, which is great. So that is one of the beautiful successes that we've had in holistic human care. All right, now fluoride is still an issue. I couldn't believe it. The top university here in Thailand, Chulalongkorn, is still saying it's okay. All right. So we've known since 2006 that fluoride is a neurotoxin. We know that. We know that it destroys nerves and synapses. We know that it accumulates in the hippocampus, which is really important for memory and emotion, and very, very important. Okay. But when children get it and it begins to collect there, then it becomes the root of neurodegenerative diseases later on. Okay. Now the pineal gland, for some reason, accumulates fluoride. And when it does, fluoride being a halogen with a negative transition metal, such as calcium, where you get calcium fluoride. So you get calcified pineal gland. That's a big deal, because if you calcify the pineal gland, remember what the pineal gland is, okay? It was referred to as the biological third eye. But what does it do? It produces three really important hormones. Number one, it produces something called melatonin, which I'm sure you're all familiar with. And if you know that melatonin is really it's not a hormone in the normal sense. It's actually a neurotransmitter, right? Because it's made by the same route as serotonin, right? You start with tryptophan, which becomes serotonin, and when the lights go out and you go below a certain luminosity, it stimulates another enzyme which brings it over to melatonin. And melatonin, yes, it establishes the sleep cycle, and you start to go to sleep. But what else does it do? It's one of the most powerful antioxidants we've ever seen. For example, each melatonin molecule will grab 4 hydroxyl radicals. Hydroxyl radicals are one of the end biological intermediates, toxic intermediates that accumulate in cells. Okay, and it's very toxic. It destroys cells. All right, so we have 2 main ways of getting rid of it. One is we produce about 10 liters of molecular hydrogen during the day, gas, and it goes into the cells and neutralizes hydroxyl radicals. But then melatonin at night, every melatonin molecule grabs 4 of those hydroxyls. All right, so while we're asleep, the melatonin puts us to sleep, then it turns into the night janitor and cleans up. The third thing it does, activates T cells, activates natural killer cells. It's an immune enhancement, which is why blind people have 1/3 the incidence of cancer as people who can see, because they have high levels of melatonin because they're always in the dark. Okay. We know that fluoride is associated with osteosarcomas, a horrible bone cancer, right? Hypothyroidism, lowered IQ, it goes on and on and on. What else do we know about fluoride? In communities that are fluoridated, we see a higher incidence of hip fractures, right? It makes bones stronger, true, but it also makes them equally as brittle, and they break easily. That is not told to you, is it? So here's dental fluorosis. Looks really nice, right? You want to get some fluoride? Want to get some fluoride toothpaste? Okay. So you get permanent defects in the enamel if you get it during the first 8 years of your life. All right. And in the Journal of the American Medical Association, they show, and other publications have shown, how it is associated with what is called subclinical hypothyroidism. And why is that important? Because if you're hypothyroid, everything is low. Thyroid is like the thermostat of energy in our body. One thing. Thyroid also, if you study it, you'll find out that both thyroid and melatonin are probably the guardians of the immune system. What I forgot to tell you about the pineal gland is that in addition to melatonin, it produces another hormone called epithalin, which controls melatonin, and it helps maintain longevity. In fact, if you get the peptide epithalin and you do injections twice a year, you will increase your telomere length by 30%. This is proven, published research. Okay, epithalin. The third thing it makes is dimethyltryptamine, DMT, which we always think of as that's the molecule that comes from people that go down to South America, and they meet with a shaman and they take ayahuasca. ayahuasca does is it results in producing a dimethyltryptamine. It's been called the spirit molecule. Well, that's the molecule that is released at the moment of death, right? And it saturates everything. It's also released during our life when we have a transcendental experience, right? You're looking at an incredible sunset. You're looking at the Grand Canyon. You're watching a baby be born. You're falling in love with someone. That's when we're releasing the dimethyltryptamine. Okay. If it gets calcified, if this gland gets calcified, and we lose our humanity. All right, and arrhythmia is everything. Okay, so now, I gotta keep moving this thing. What do I do? Let me do this. Yeah, there we go. Okay. So these are just some of the health conditions: bone weakness, fractures, diabetes, insomnia, osteosarcomas, precocious puberty, iodine deficiency, arthritis, cardiac, neurotoxic, goes on, TMJ, you name it, that's fluoride. And it's still being promoted. It's still being promoted. That reminds me of other things being promoted that one might question, such as, I don't know, mRNA vaccines. It's incredible. Now, in case you don't believe it, here's a few references. And that's not enough, here's a few more references. And there are more to show you that what we're talking about here is this is an industrial waste product that used to be used as a pesticide before it became part of our water supply. Yes. Galvanism, I was talking about that. When you have two dissimilar metals in a saline solution, so that you have electrical energy, you've got a battery. All right? So I want you to think about it. There are no pure metals in our mouth. When they say I'm going to give you a titanium implant, it's got aluminum and vanadium. It's only maybe 40-50% titanium, and the rest is other metals, and they do that to strengthen it. So you've basically got two metals. You've got galvanism because saliva is has got electrolytes. It's a current. All right. Amalgams amalgams have everything, right? Okay, and then gold, even a gold inlay or an outlay, it's not gold. It's maybe 30% gold, 40% gold. The rest is metals. So you're producing galvanism. All right. Now that means you've got electrical currents going on in your mouth. Why is that not good? Well, it does it causes a lot of damage. Not to mention, if you realize that we know what an electroencephalogram is, right? Right? We know that, right? We look at now they're looking at electromagnetograms because, as you know, the electromagnetic, the reality of electromagnetism is you've got electricity going in one direction, and then at 90 degrees, you've got a magnetic curve. They go together. You don't have electricity without magnetism. You don't have magnetism without electricity. So we've got an electromagnetic envelope that we're living in, right? Then from our heart is actually stronger than the brain. So you've got the heart and the brain with this large, incredible electromagnetic, I don't know what to call it, cocoon, whatever, and it's probably the physical or the semi-physical or the bridge between us and the Atman, So, or it is the Atman. I mean, I don't know what it is, but anyway, it's very important. Now you've got all these electrical currents that are disturbing that. That's number one. That's just one thing. Not to mention that electricity also directly feeds microorganisms that you don't really want in your mouth, and it empowers them and makes them stronger as well. Now, so the bacteria are energized, which allows them to build up the plaque, the tartar calculus. Okay, and then these bacteria now produce more acid, and you got the cycle going on. Okay, what does the excess acidity do? It increases the galvanic discharge. Okay, you wind up losing teeth and all that. We're going to get more into that. Now, the neurological complications. Okay, look at them. I'm not going to go over them all, but you name it, including carcinogenesis, bleeding gums, insomnia, fatigue, drowsiness, anxiety, nervousness. What? Yeah. From metal in the mouth. Okay, now let's look at infected teeth and root canals. Okay, so here's a tooth, right? And you've got the core here, right? And you've got blood vessels, lymphatic vessels, you've got nerves, all right? Now, you've got an infection down here. All right. So what they do in a root canal is if they extract the tooth, that's one thing. The problem with dental extractions by regular dentists is that they leave the periodontal ligament. They don't take it out. They leave the periodontal ligament. So they pull the tooth, they squirt it with some water, and they give you a gauze, and they tell you to go home. You go home. What happens? Over time, your gingiva, your gums heal. And as they heal, in there are billions, maybe trillions of microorganisms that are in there. And what do? Well, they see that periodontal ligament. What's a ligament? For those that you're not medically trained, tendons connect muscles to bone. Ligaments can connect bone to bone. So you've got your anterior cruciate ligament. Everyone knows about that. With your knee, runners have a problem. That's connecting two bones. You've got ligaments connecting the bones in your ankle and your hands. Okay. So ligaments do that. Well, the ligament that connects our tooth to our to our jaws is called the periodontal ligament, which means you got all these microorganisms in that area that's been closed, where the tooth has been extracted, and that ligament is like a highway right into the jaw. So these microorganisms go right into the jaw, and they set up camp, and they start developing and growing. Now, because they're in the jaw they're pretty much protected from the immune system, and so they just happily grow and mutate, and they produce, it's called fatty degeneration, osteonecrosis of the jaw. All right, it's not taught in dental schools. You gotta try to realize that's not taught. They don't see it. They're looking at the X-ray. They see these, but they anyway. That's from an extracted tooth. Now, in a root canal, what they do is they take out all the stuff in the root. They take out the blood vessels, the roots, etc., like that, and they fill it up with gutta percha, which is a kind of like a cement. All right, and they do that, and they sterilize it with what? With chemicals. And the chemicals, I'll show you later, do not sterilize. Anyway, so you've got a lot of microorganisms in there. You put in the cement, and then you put on a crown, and you're good to go. You got a functional tooth. And meanwhile, down there, all those microorganisms that are in there, now there is zero immune surveillance. Why? Because there's no blood vessels. There's no blood going there. It cannot carry the microorganisms. And there's no lymphatics. And so you get these incredible mutated organisms that are producing biotoxins. All right? It's incredible. And I'll tell you clinically in a minute what this done. So here's Weston Price. Amazing guy. Okay. Graduated dental college in Michigan, 1893. 2 weeks after, well, it wasn't really 2 weeks later. He performed the root canal therapy on his 16-year-old son who died of endocarditis. He took the same tooth, implanted it into 200 rabbits. They all died of endocarditis. He worked for 25 years trying to find a way to make a root canal treatment work. Okay, and he published this incredible 2-volume book, Dental Infections, Oral and Systemic and Dental, Degenerative Diseases. Okay. But after 25 years, he concluded there is no viable way to sterilize root canal. It's just one guy. No, it's not one guy. All right, Dr. Charles Mayo, the founder of the Mayo Clinic. You may have heard of the Mayo Clinic. Dr. Frank Billings, who was president of the American Medical Association, and blah, blah, blah. And Weston Price, of course, and then Edward Rosenau. All these guys independently weren't doing it together, were trying to do the same thing. They were extracting root canals and planting them into animals. So someone has, let's say, rheumatoid arthritis. They take the tooth out, put it into a pig or a rabbit, it gets rheumatoid arthritis. Breast cancer. Into it gets breast cancer. Whoa. Yeah, okay? These animals died of the same condition that the person had that they took the tooth out. And I'm not making this up, and this is all history, and it's all researchable. You can find it. So go find it. Why? Because your job is to help people heal. And this is a big deal. There are no healthy root canals. It's not possible. Do you understand that a root canal is the same thing as taxidermy. You know what taxidermy is? Where they take a dead animal, they remove its innards, and they stuff it so that you can keep it on your shelf and say, oh, that was my pet. Yeah, whatever they do. You know, and also museums do that as well, taxidermy. So that's what a root canal is. It's taxidermy in your mouth. Okay, you've got dead tooth. You've got something dead in there. Now, we never, when we're doing surgeries, leave anything dead. We would not go in and a burst appendix, we'll go in and clean it out and leave the dead tissue there. No, we're not leaving, we're gonna take it out. Why? Because dead material is a banquet for microorganisms, and it becomes the nidus of an infection. So here's one study in the European Endodontic Journal, 2021. So what they did was the microbial investigation in teeth with persistent secondary endodontic infections in different stages of root canal treatment, okay? And what they found was the microbiota in polymicrobial, right, many organisms, gram-positive, gram-negative, and they had all these different, and they had anaerobes, okay. These are some of the main guys here, the Enterococcus fecalis and the P. gingivalis. They found that by using the chemicals that they used to sterilize the root canal, they reduced the levels, but they didn't get rid of them all. And if you don't get rid of them all, they're going to procreate. And microorganisms, the bacteria, they have a new generation every hour, so you do the math. All right? Now, these two guys here, Enterococcus fecalis and P. gingivalis, are associated with systemic illnesses all over the place. Okay? Enterococcus fecalis, 10 to 15% of systemic illnesses in hospital settings, sepsis, endocarditis, urinary tract, are coming from here. Okay? P. gingivalis, all right, from periodontal conditions. 50% of humans globally have this, all right? Cardiovascular conditions, diabetes, rheumatoid arthritis, et cetera, et cetera, et cetera. Anyway, significant. So the periodontal endodontal continuum. Okay, so over here is what a tooth. Okay, now you've got the dentine tubules. You know the these little tubules in there, in the accessory canal. And down here is the apical foramen where it all comes together. All right. So the microbiota of the periodontal pocket. Now, what the pocket is when you go into the dentist, they will measure the distance between the gum and when they get into the where the bone begins. All right, it's normally less. It's 1 to 3 millimeters. If it's more than that, then you've got what's called a dental pocket, and if it's more than that, you've got problem. You've got periodontal problems. Okay, so the communication between the apical foramen, the dental tubules, and the accessory root canals allows this root canal procedure, all those microorganisms, to communicate that way. That's how they go in there, right? Now, why do we have all these things? We got them because of embryonic development, and they've wind up remaining there. Okay, so a root canal infection can actually cause complete destruction of the entire apparatus in there. So when the dentist looks at it and they do a 2D X-ray, they can see, aha, this root canal went bad, because they actually see that it's now starting to destroy the alveolar bone, the bone in which it's sitting in the jaw. They're seeing that. But I'm going to show you in a minute how these 2D X-rays are almost useless, okay? And it destroys the periodontal ligament. Now, here's the difference. Here on the left, you see, is a 2D, you see it, a two-dimensional, and you're looking at this root canal, and you say, that looks okay. You look over here, and what do you see on the 3D cone beam CT? You see here an abscess right at the root, which you don't see on the 2D. You would have missed it. Not okay. How about here? Everything looks fine. Look at all these abscesses throughout the jaw. This is a big deal because it goes up into the sinuses. A big deal. You can't miss things like this, but it does. And to this day, dentists are still doing panoramic 2Ds, and they're saying everything's okay. Now, the CT, people say, I don't want to be exposed to all that radiation. Well, it's only a 20 to 40 second, I've had it, okay? 10 times less than the exposure to a CT. CT is the whole body. This is real quick. And in medicine, you know that we always look at risk benefits. Is what I'm going to do worth the potential results? And in this case, yes. Because if I didn't get that, if I didn't see those deep infections, the person could die. But if they didn't die, they could suffer greatly with all sorts of things, and I'll show you in a moment what those are. Versus a 20 to 40 minute exposure, it's definitely worth it, okay? So they send people, so in the top image here, this is Dr. Emma. She was a long history of sinus infections. They went to the ENT, ear, nose, and throat doctor, and they found nothing again, all right? They couldn't see the damage. They went to her, she fixed it, they're fine. Dentist sent them to the ear, nose, and throat doctor. They couldn't find it either. Another one. So here is the motto: anything metal or dead should come out of your head. Anything metal or dead should come out of your head. Okay? Easy, easy, easy. Okay? Dead tooth. No, there's no good. Well, this root canal looks good. We're going to save it. You don't save. You don't leave something dead in the head and save it. All right? Okay. So here's a person. Look at this. As a 58-year-old, yeah, and they had, here's the 2D, it looks great. Look over here, you see 2 abscesses. You see that? Severe abscesses. This is what was taken out. These are the abscesses. Okay, when they sent this stuff for DNA analysis, these are the organisms they found. Okay? Fatty degeneration. Another one, someone had refractory hypertension, high blood pressure, right? Again, 2D model, didn't see it. The CT, look at that big abscess. This is what they took out. Fatty degeneration, osteonecrosis, okay? Blood pressure went back to normal. So, but by the way, here we are, doctors. How are we going to... We got someone with what they call essential hypertension, right? 90% of high blood pressure is essential hypertension. That's a real nice medical way of saying we don't know why they have it, but we're going to call it essential so we sound smart. We sound really smart, right? Meanwhile, the patient doesn't feel so smart. They have high blood pressure, and we're calling it essential because we don't know. Why? Because we are not evaluating the mouth, because we somehow believe our teachers who told us the mouth is not part of the body. Now, I just want to show you, this is a brief literature review on the Rantes and relationship to colorectal cancer, cardiovascular disease, inflammatory bowel disease, liver cancer, etc. All right, so what is Rantes? Okay, it's an acronym for regulated activation, normal T cell expression and secretion. Okay, what it means, and basically, it's a chemokine. It's a group of chemokines that are involved in the inflammatory process, okay? And what is the role of these chemicals? Is that they recruit immune cells. So for example, if you know that for IL-2, interleukin-2, is a interleukin that is activated during certain situations like fever, etc., and it is a recruiter. It sends out signals telling the T cells and monocytes, and we need you in it. Hey, one of the reasons we get fever, by the way, a fever is not an indication of a Tylenol deficiency. In spite of what they told you, when I learned the right orders in the hospital, I said, if the fever gets above here, what? The fever is how the body activates the immune system. The poor lizards and snakes who are not warm-blooded, and they get sick, they have to crawl onto a rock and bake in the sun in order to get their immune system activated. All right? So anyway, a fever is a blessing. Anyway. Okay, so they recruit all of these cells to the all these inflammatory necessary immune cells to the site of action, right? So it's a signaling molecule, okay? And this is how it's classified in the chemokine family, CCL5, okay? So it attracts immune cells to areas of injury, blah, blah, blah. Inflammatory signals, and all that sort of thing. So it's very, very important, very, very important. So What they're saying though, however, the problem is that gets out of hand. So if you've got an infection in your jaw that nobody knows about, and by the way, you don't feel it. Why don't you feel it? Because it's in the, there's no nerves there. You don't know you have it. And so you don't know you have it, but meanwhile, it's producing all these inflammatory signaling going all over the body, right? Now, what does that do? We're finding that that is causing all sorts of systemic illnesses. Yes, tumor progression, inflammatory, you name it. So what does the medical profession want to do? Well, under the direction of the General, what's his name? General Rockefeller, the medical profession wants to go to war against it. Let's block it. So they're going to block either the RANTES or the receptor. Block it. Let's not prevent it from happening. Let's block it. Let's go to war against it. Does it work? No. All right. So, just in terms of cancer, I have to talk about that. Its relationship to breast, overexpressed. Prostate, overexpressed. Ovarian, pancreatic, colorectal, lung, glioblastomas, the brain, yes, it's all involved in that. Meaning that all of these different locations of where the cancer is beginning could have its origin in our mouth, and we don't even know it because we don't have any symptoms. So tell me, how can we examine a patient, evaluate a patient, and feel that we did a thorough job when we didn't look at the mouth? We can't. So these are the mechanisms by which it was doing that. Okay, it recruits the pro-tumoral immune cells, which are macrophages and Tregs, T regulatory cells. It enhances new blood vessel growth. It promotes tumor cell survival, invasion, and spreading. And it suppresses the anti-tumor response. That's kind of what? That's not too cool. So again, we're going to block it. Now, this is what the in oncology, they said that there's a revolution in cancer treatment with this immunotherapy. So they've got these PD-1 and programmed F ligands, PD-L1 and PD-1L blockers. They're going to block it. And they said it's a revolution. So I looked up and did the research, and I wanted to see what that revolution in cancer care has meant. And you know what it has done? You get nivolumab. I think you get, instead of dying in 10 months, you die in 13 months. Anyway, they're all just a few months. They just stop things from happening for a while, these PD-1 block, these checkpoint inhibitors. They want to do the same thing now with this. They're going to block it. They're not going to stop it from happening. They don't want to find out the cause. They're just going to block it. Now, let's shift gears here a little bit. I want to talk to you about these major dietary shifts in human history, okay? 11,000 years ago, when they find a skull, a human skull, they have all their teeth. Maybe one is gone. Why do they have their teeth? Then around 10,000 years ago, 9,000, we look and they're starting to lose teeth. What happened? Well, they're calling it the Neolithic era, okay? This is when we went from hunter-gatherer to carbohydrate-rich farming diets. Well, hunter-gatherer, that wasn't quite what we were, but for a moment, I'll talk to you about another lecture, okay, because we were not hunter-gatherers. We may have been hunting for apples. Anyway, we'll talk about that. Anyway, I've got a lecture on food. I want to talk about it's called the true human diet. We'll talk about that. That's another thing. But I've got all the data. So by the time I want everyone to see this lecture, I'm going to webinar, because there seems to be a lot of controversy about what we should eat. Unless you look at the situation, there's no controversy. Anyway, so about 10,000 years ago, we started to farm and we started to have grains. What we noticed, or what has been noticed, is when they got the skulls, and they were looking at the biofilms, because they stay, plaque, it stays for millennia. They're finding that the microorganisms in the mouth changed. They changed because we were feeding them differently. Okay. So, here in the European skeletons, they looked at the transition, led to a shift in microbes with an increase of these disease-causing colonies. Yeah, this is true. But that microbiota didn't change from about 10,000 years ago until about 1885, when we started to have machinery to process foods, right? We refined the grains and the sugars. And we came up with a lot of these mono and disaccharides, all right? And that's when we had another final shift in our oral microbiome. And now the microorganisms that predominate in our mouths are associated with all of the chronic illnesses we have. Yes, 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 yes. And you can't, if you don't agree or you don't think that might be true, show me. But the data shows it, okay? So what do we have? We now have, now that we have all these refined sugars and stuff in our mouth, what do we get? We get organisms that are going to ferment them. And what happens when you ferment? Glycolysis. What happens when you ferment? You produce lactic acid. So you lower the pH, okay? What does that do? That demineralizes the enamel and you get what are called cavities. Okay. What's very interesting though is that the microorganisms that are associated with caries, the ones that they're what they call acidogenic. In other words, they produce acid. Those that destroy the enamel and make actually holes or cavities in the teeth are completely different than the microorganisms that are associated with this, which is with what is called periodontal disease. Periodontal disease is when you are affecting the periodontal area, which is the structures supporting the tooth, such as the gums, gingiva, the periodontal ligament, and the alveolar bone. Those are supporting it. So now these microorganisms go under the gum and they're in there, and they're completely different because they are anaerobic and they require an alkaline environment. And because they require an alkalinity, that's not what the microorganisms that are acid producing need to destroy the teeth. So if someone's got nice looking teeth, they probably have periodontal conditions. We don't see them. You won't have both. You're either going to have periodontal or you're going to have that, except in a few cases. And I think in India, we actually do have both going on, okay? Now, and we lost, when we got this change, we lost these guys, these ruminococcea were our saviors. These microorganisms are now in a minority, and the other ones are in a majority. So we've reversed it. When those were in the majority and these in the minority, we were vibrant, healthy. We had all our teeth and all that sort of thing, and we were healthy. Okay, now, what is a biofilm? Okay, we all know what a biofilm is, all right? Basically, what it is that the microorganisms, they produce it's like they make a blanket to cover themselves, to protect themselves from the immune system, all right? Okay, so they produce this extracellular polymeric substance, right, in the matrix, okay? And it kind of covers it, seals it off, and that's what they found, by the way, when the archaeologists were looking at the heads and the skulls from 11,000 years ago. They still found that plaque. It was that powerful, that strong, all right? And that is what forms under the gums in the periodontal area. Though that plaque is what forms that causes periodontal disease, periodontal conditions. And that's why when you go in for a deep cleaning, they're supposed to clean that out. But you don't clean it out with bad chemicals. You clean it out with things like what? Oh, how about ozone? Yeah. Anyway, we'll talk about that later. Okay, so anyway, this EPS provides the biofilm with adhesion, protection, and nutrient retention, allowing it to thrive in the oral cavity. So it allows them to wall themselves off and have like their own little ecosystem, okay? So what's the difference between a dental biofilm and dental plaque? Nothing. I mean, just very little. Okay. The dental is a thin, invisible layer of bacteria on the teeth. You don't see it. The plaque is when it becomes visible. And it's a sticky film, all right? So plaque might be considered a grown-up version of biofilm that can be seen. All right, now, yeah, okay, so we talked about that. Anyway, in periodontal disease, we have anaerobic proteolytic bacteria, all right? We have the red complex, which is P. gingivalis, Tannerellia, and Treponema, which is a spirochete. We also have the orange complex, which are these three guys, all right? Together, they produce inflammation and destruction of periodontal tissues, okay? Due to a dysbiosis in the subgingival biofilm. I mean, from the gums up in there, where you can't get to. Brushing doesn't get there, okay? Now, they require a neutral to alkaline environment, right? But, you know, S. mutans doesn't like that, and S. mutans is the main acidogenic bacteria involved in caries, all right? They produce lactic acid. They like acid. These guys like alkaline. They can't be together, okay? Now, by the way, these guys here, the S. mutants, which is Streptococcus mutans, which is the main one, they're associated with so many systemic illnesses, and that's where they come from. So it's not that there's an association between the oral health and the body. It is causative. And imagine we overlook it. So here's the shift, and we're not going to go over to this, but you can see pretty much the Mesolithic, Neolithic. Okay, you can see the changes here, and you see Firmicutes, which was over here big, and oh, we lost it. Yeah, we lost the good guys, and we got the bad guys. All right, now we're going back to that long tube. Remember that tube that begins with the lips and ends with the anus. All right, that tube. You take care of that tube, and you will, like Spock, live long and prosper, okay? By the way, I know we forgot that in medical school, but the oral cavity and the gut are contiguous. Oh, imagine, all right? All right. Now, there's only two things that separate the microbiome, and that is the bile. Bile is, bile acids and all that, pretty powerful, can wipe out a lot of organisms, right? And also the pH of the stomach. So those are the two metabolic or chemical or biochemical barriers between the microbiome of the gut and the microbiome of the oral cavity, all right? But, the Human Microbiome Project, right? What they found that it was half of the bacteria, right? half of the bacteria in the body are in the GI tract, which includes the mouth and the gastrointestinal tract, right? So 29% in the GI tract that we know of, and 26% here. That includes all of them, right? So in the oral microbiome, we have over 700 species. In the gut, we've got over 1,000. All right, and their interplay, and they're going back and forth, right? Like, the pH of the stomach is supposed to prevent them from happening. Well, tell that to H. pylori. H. pylori says, hey, that's fine. I'll take the acid, right? And for those that you're not medically trained, H. pylori is a microorganism that lives in the stomach, likes acid a lot, and it's associated with ulcers and gastric cancers and things like that. Okay. So the interplay between these two biomes gives you such consequences as diabetes, cardiovascular disease, arthritis, non-alcoholic fatty degeneration of the liver, inflammatory bowel disease, cancers, and everything. Yes, from there. Now, here we go again, Weston Price. What did he find out? All right. All these guys, these savages, they're not civilized like us. Well, they had all their teeth, and they didn't have Colgate, and they didn't do all the stuff we did. All right. So he traveled around the world, and he's looked at the traditional diet, and he found that those who ate whole food, nutrient-dense foods, had beautiful teeth, right? They had fat-soluble vitamins A, D, and K2. They were crucial. Anyway, whole foods. What is whole food? I can tell you something. If you buy anything to eat and it's in a package and it's got a label, you throw it away. You don't learn how to read labels. You got to get a master's in chemistry to read the label. And what is a label telling you about food? A label's telling you what they've hidden from you. And if you look at it and you could actually read it, you say, hell no, I don't want that. Right? Now, if I hand you a banana, do you need a label? Nope. If I hand you food, you don't need a label. You only need a label for things that are hidden. So if it's got a label, don't eat it. Easy. Hal Huggins, another incredible guy, right? All right. He kind of brought holistic dentistry, real dentistry, to the world. Okay, and he came up with the Huggins protocol, and it was a big deal. I remember way back, 20 years ago, people were going to 25 years ago, people were going and get trained by him. Okay, but of course, what did they do? His reward for speaking out and telling the truth. Remember, the truth, you're not supposed to really talk about the truth. They took away his license. It's okay. So he just taught other dentists how to do the right thing. All right. Yeah, and he had a degree, of course, in immunology and toxicology. He was the guy who started talking about mercury. And in those days, if a dentist said anything about mercury other than it's great, they had their license taken away. Now, very interesting, very interesting. Rice versus other starches. We talked about that transition 10,000 years ago, and that was because people were eating wheat and other kinds of grains. Well, we noticed in Vietnam, Thailand, and Japan, Taiwan, it wasn't happening. It didn't happen the same, and they were eating rice. But the rice, of course, was unrefined, so it's what we today call brown rice. But and I'm not sure about India. I'd like to do the research on that. But we did not see that transition in the microflora, the oral microflora, in these countries who were just eating rice, and they were not eating the other grains. I think that's very interesting, right? All right. Now, cooking. When I do my lecture on food, we'll talk about cooking. But here, basically with this. So the experiments are that eating raw starches produce very little acid. Raw starches produce very little. So if you ate a potato that was raw, not a lot of the starch. But when you cook it, it breaks down the membranes, and you start to get starches that are, it breaks it down into mono and disaccharides, and you actually start to ferment it, and you get acids. This is why farmers, when they're going to take their pigs to market, they start feeding them like boiled potatoes. They get fat, take them to market. Carbohydrates such as fresh fruit and vegetables have a lower carcinogenicity, are eliminated rapidly. All right, so consumption of soluble starch and sugar together is more carcinogenic than sugar alone. Okay, you got that? Soluble starch and sugar together causes more cavities than just sugar alone. Anyway, basically, I got one rule for you: don't cook. But we'll talk about that later. All right, now I want to show you that oral systemic link that I didn't learn in medical school. All right, here's a tooth, enamel, the dentin, pulp, root canal. It turns out that they are related to our organs. Okay, these are called meridians, and the Chinese have known this for over 5,000 years. All right, just like in your house, if your bedroom light, your bathroom light, and kitchen light go out, you go into the fuse box, you put in one fuse, and they go back on. Okay, they're on one circuit. That's what these are, and all of the circuits of our body go up through our teeth. Why? Because it's at the top of the spinal column. Okay, and it's connected to the cranium. Very important thing. So every tooth is connected to different organs, right? And I want to tell you something. If you look over here at you've got the, third molar, which is the wisdom tooth. Next to it, right? You've got. I'll show you on another chart. Anyway, you got the breast. You got the thyroid, the breast, the stomach, and on the right, it's pancreas. On the left, it's spleen. All right. Now, give you an example. I had a woman in New York with inflammatory breast cancer, right-sided inflammatory breast cancer. She was gonna. I was in Long Island. She was going to go to Sloan Kettering Memorial, one of the great cancer hospitals in the world. She was going to go there for a clinical trial because she was worried about this. I said, clinical trial. You know that that's a euphemism for an experiment. I know. Okay, you can go. So I examined her, found out she had a root canal on her breast meridian on that side. I said, okay, you can go to Sloan Kettering, whatever you're going to do, but get this out first. So I sent her to a real biological dentist. What did he do? He took it out. He took out the periodontal ligament. He irrigated it with ozonated water. Then he put in ozone gas. He also used some laser. Put in some ozone gas so it can go up into the trabeculi of the bone. For those of you not medically trained, trabeculi are these guys down here. Wait. Can you see over here? These little holes? Yeah. Okay. Goes in there. Why? Because the microorganisms are hanging out in there. Gets it in there. Now, they've already taken your blood test, they've spun it, they take it to the platelet-rich fibrin, and they seal it off. Sterilize and seal it off. That's why I call it logical dentistry. Logical. Instead of squirting it with water and letting it heal and giving you some gauze. Anyway, so she went, about 6 weeks later, the trial was going to start. She went to Sloan Kettering, and they told her, I'm sorry, you're no longer eligible for the trial. You think she was sad? No. All right. How many times have I seen that happen? It's on the colon meridian, we take it out, they don't even need treatment. It's that profound. Now, I may have believed it. Now, okay, I'll show you in a minute. Okay. Now, by the way, what drains your batteries? Dental infections. All circuits pass through the teeth, and infections break the circuit. Emotional baggage breaks the circuit. Toxins breaks the circuits, and scars break the circuits. You want to leave all your circuits open because you want to be flowing and harmonized and balanced. And that's what Ayurvedic medicine does. That's what traditional Chinese medicine does. That's what all the indigenous medicines do, is they restore balance. They don't have the arrogance and ignorance to think that they're going to fix something that's not even broke. It's not broke. It's out of balance, and it's compensating. Restore balance. Because you're not going to figure out the body. Not possible. You've got minimum of 37 sextillion chemical reactions every second. Sextillion is 21 zeros every second, and each one depending on the other. You going to figure that out? Anybody going to figure that out? No. Okay. And you're making at least 37 million new cells a second. So you have this dynamic process going on called life, and you're going to intervene and do something? No. Just bring it back into balance, and the divine intelligence that put it together will keep it together. Okay? Now, I want to tell you this little story here. It's me, okay? About 4 years ago, I developed atrial fibrillation. Out of nowhere. And for those who are not medically trained, atrial fibrillation is when you have an irregular heartbeat. It would go, anyway, there was no rhythm to it. So I was always tired. I couldn't exercise. I couldn't figure out how did this happen? I didn't have hypertension. I didn't have any of the risk factors. So anyway, I was in America because training a new doctor at my clinic, and I went to get some. I went to get some training from an internist in St. Louis named Dr. Simon Yu, and he does the acupuncture meridian assessment. So I went to him, and I was training, and I said, "Hey, by the way, why is my heart doing this?" So he looked at the acupuncture, and he goes, "Oh, number 16 and 17. Now look over here, you guys. See here, 16 and 17, wisdom teeth. I didn't have these removed, but I had these two removed. I don't remember the problem. All right? So they were removed. 25 years ago, I said, what do you mean? I don't have any pain. There's no swelling. He goes, that's your problem. And I looked and I said, wait a minute, they're both on the heart and small intestine meridian. So I went back to Arizona and I went to my biological dentist, Dr. Mike Margolis, and he said, I don't see that on Panorama, but I see one of them on the. He goes, anyway, if Dr. Yu said it, we're going to do it. So he went in through the gum, he found pus in both of them. Took the pus out, ozone, the whole thing, sealed it within 5 days. My heart went back to normal, and it's been that way for 3 years. I did an EKG about 2 or 3 days before I went to see Mike, and it almost looked like heart block. It was, I mean, the nurses were freaking out. I mean, it's like normal. And I had that done. Because he found what? What was up there? Cavitations. Why were the cavitations? Because the microorganisms went through the periodontal ligament that they didn't take out. So he sent that pus for DNA. What did we find? Look, anything above 9 is considered, okay, what's not above? Now, over here on this tooth, not only did I have all these microorganisms, I mean, I have all these bacteria and stuff, I had, look, where is it? Entamoeba. That's a parasite. That's a protozoal parasite in my jaw for 25 years. And I didn't know it. So anyway, you see what I mean here? Look, next to it, next to the wisdom teeth, you've got these two teeth. Breast, thyroid. So the breast and the thyroid are all together on this side. I didn't learn that in medical school. Dentists don't learn that in dental school. Anyway, let's look at it here in India. Here's what's going on. India, 17.3% of the world's population. 1 out of 6 people on the planet are Indian. 72% live in villages. In these villages, 27 are in urban. Life expectancy, 68 years. The dentist to population ratio is 120,000. 200, is that what? 200,000. 95% of the population has periodontal disease. Whoa! 50% use a toothbrush, 2% see a dentist. Okay, you guys, so we got some work to do. We got to get biological dentistry in India. It's got to be #1 priority. Okay? Now, what is periodontal? Here's the structure of the tooth. All right? And as you can see, okay, mild to moderate, you get gingivitis, and then it goes on. So it's under the gum. You're not going to see it. And eventually it goes down and it gets here, the periodontal ligament, then you get bone loss and you lose your teeth. So here, these teeth look nice, but look at all this. So gingivitis, reversible superficial inflammation of the gums. Periodontitis, anaerobes, you got the pocket. That's where now 5 to 7 millimeters from the gum to the bone means you've got some bone loss. Okay, so biodentistry, what would they do? They would take extraction of the tooth, they would remove the periodontal ligament, they would clean with ozonated saline, then ozone gas, seal with platelet-rich fibrin, and then after 8 to 12 weeks, they put in a zirconium implant. You don't put in a titanium implant, put zirconium implant, okay? Because it's not a metal. Remember, leaky gut is leaky gums. It's all one thing. Now, International Journal of Oral Sciences. Oral microbiome and human systemic becomes prevalent during the transition from the hunter to gatherer. We have a shift in the oral microbiota to periodontitis-associated bacteria, which is P. gingivalis. These are the main pathogens of periodontal conditions. When they colonized, they changed the commensal microbes. Commensal means organisms that are living with us, they don't harm us. And it changes that. Stimulates an inflammatory bone loss. Now remember, we swallow 1 to 1.5 liters of saliva a day. So anything going on here is going to get down there. So we wind up with a low-grade systemic condition, all right? Alzheimer's, yeah, everything, you name it, preterm labor, you name it. Now, the relationship between periodontal conditions and cognition, tooth loss and cognition, there is a dose-response relationship between tooth loss and cognitive impairment. The more teeth loss, the more the cognitive decline. And I'm not just talking about the social things of, you have a change in dietary habits, you get kind of isolated because you're losing teeth, you lose your self-esteem, okay? Anyway, it's even related to Alzheimer's. Now, let's look at the oral microbiome and cancer. Inflammation promotes carcinogenesis, and this we've known this over 150 years ago by Virchow. Rudolf Virchow was a pathologist who he wrote the book on cellular pathology way back when, in 1850s, 1860s, and he's the one who invented autopsies. He's the one who, a lot of Virchow's node, anemia, a lot of the terms we use. He's maybe the founder of pathology, which is the doctor's doctor, pathology. You know what he said? He said, if I had my life to live over again, I would devote it to proving that the microorganisms are there to clean up the mess. They didn't make the mess. Just like the flies did not make the feces. Interesting. The terrain versus germ theory. Okay. So here's how it happens. For example, HPV in the oral, cervical, and anal cancers, right? Human papilloma. H. pylori we see in the gastric and the right? Lymphomas. Chlamydia, lung cancer. Salmonella, gallbladder. S. bovis, all these organisms, colon cancer. These guys, oral cancer. This, esophageal cancer. And these, pancreatic cancer. Yeah, they come from the mouth. Yes. Hematopoietic and lymphatic CF. Now, by the way, I don't call it cancer. I'm calling it cancer now because I don't want to go through the whole thing right now. But cancer is a horrible word, right? It has no meaning at all except somebody born between June 21st and July 22nd. That's all it means. It has no other meaning except it causes tremendous fear, and people agree to anything because they're in a state of fear. So we call them what they really are, chronically fermenting cells, CFCs. That doesn't make you afraid. So even when I say the word, it hurts. Well, I'll use it a little bit more here. Anyway, so cancers that form in the bone marrow, right? Leukemias, pancreatic, lung, colorectal, breast, oral, and then edentulous, loss of all your teeth associated with pancreatic. By the way, did you know that mercury can cause heart disease? Mercury fillings cause heart disease? Oh, how does that do it? Oh, associated with oxidative stress, inflammation, endothelial dysfunction, critical factors in heart disease, increases reactive oxygen species, leading to damage in the vascular tissues. Inflammation, chronic exposure triggers systemic inflammation. IL-6, tumor necrosis factor alpha, etc., are related to hypertension, atherosclerosis. Blood pressure, oxidative damage to lipids. So it oxidizes the LDL. By the way, cholesterol is not bad, it's necessary. Okay, that whole thing is nonsense. What they don't measure is the oxidized LDL, because that's the one that's going to cause the problem. If it's not oxidized, it won't cause a problem. Anyway, mercury helps you along in that way. Mercury does that. Okay, antioxidant, it wipes out. Mercury binds to the sulfhydryl groups in glutathione which blocks our ability to detoxify. All right, and it's an immune toxic agent. Did you know that feelings are because of anxiety and depression? Yeah, the neurotoxicity of mercury, right? What does it do? It affects neurotransmitters like dopamine, serotonin, GABA, okay? Oxidative stress, right? Increased inflammation of the brain. It messes with the hypothalamic pituitary adrenal axis, right? So that's stress and anxiety, all right? It's all been mapped out. This is not conjecture. This is not theory. This is real stuff. It's science, okay? Pro-inflammatory cytokines in the inflammatory response, which causes what? Cortisol, epinephrine, stress, all right? And and with stress is what? It's fear and when you don't have, anxiety is fear without a reason, right? As a guy coming through the door with a gun, I got a reason to be afraid. But if there's no guy coming to the room, what am I afraid of? That. Part of it is this, all right? What is stress? Stress simply is when you don't like what is. Because if you like what is, it's going to be exhilarating. Me and a friend get dropped off in the foothills of Mount Everest, and they say, if you don't climb tomorrow morning, we're going to shoot you. My friend's going to go, I'm going to go, oh. For him, it's exhilarating. For me, it's stress. Okay, autoimmune and mercury toxicity, are they related? I think so. Rheumatoid arthritis, lupus. Okay, what happens? Both have immune dysregulation in response to the bacterial biofilm we talked about. Okay, so the chronic inflammation, you've got all these same cytokines and interleukins, right? Molecular mimicry, we know what that is. The antigen looks like some tissue, and so the tissue gets destroyed. Okay. Here's the big one, P. gingivalis. Remember? P. gingivalis, we talked about that. The altered microbiome. Anyway, they are related. Now, gangrene. Anything dead in the head should come out of the head. This is what Dr. Emma took out of the bone. This woman here went to see Dr. Emma. They couldn't figure out what was going on. The x-rays showed that everything was going on. She pressed right here, right over that was inflamed, and pus came out. She had gone to ENT, she had gone to an ophthalmologist. She kept having infections in her eyes. They said, Anyway, Dr. Emma pressed on number 8, it came out. X-rays didn't show it. Anyway, she had a root canal there. She had had it for 20 years. In fact, her husband divorced her because she thought she was crazy. Anyway, cleaned out the root canal correctly. The eye infection went away. She got back to normal. Everything was normal. The root canal. Okay, again, here's a big infected root canal. You would not see on 2D X-rays. And here's some other, okay. They had a trigeminal neuralgia, brown, green pus, foul odor. On number 31, tooth number 31, which is on the colon esophagus pilot, she fixed that. We saw 80% improvement. She took care of this root canal, the breast meridian, her trigeminal neuralgia went away. Anyway, it's just, there's story after story after story, and we overlook it. So there are so many conditions. Do you realize if we're giving ozone, we're giving vitamin C, we're doing all the things we're doing, but we haven't stopped the cause, it'll never get better. It cannot improve. So when I get people now, if they haven't had an evaluation and treated by a biological dentist, then that's the first thing we have to do. We're not going to even start. You know, I had a guy with he was a surgical oncologist, right? And he had a glioblastoma, and he sent me a letter, and he said, "Look, I've had 2 surgeries, I've had 2 rounds of radiation, and it's growing back. I know my prognosis. I saw an interview with you. Can you help me?" Brought him over. We found 4 root canals, 3 or 4 titanium implants, had it all around. His glioblastoma went away. I'm going to ask you, how many of you have seen a glioblastoma go away? It's a surgical oncologist. He was thanking me. I said, "Don't thank me. If you want to thank me, go tell your colleagues what just happened. Tell your colleagues." He's a surgical. Oral systemically. So the root tip from extracted or abscess takes them out frequently. Poor digestion and oral health, pH at 5.5, hypothyroidism, had right shoulder pain. Anyway, trigeminal neuralgia improved, gone. This is the fatty, look at this. You see this This is what she took out. From here, you see down here? Here's titanium. Implant had pus. Titanium, remember, is not titanium. I mean, it's got some titanium, but it's got all this other stuff. All right. So here's what happens with titanium. Over time, the metal-induced low-grade inflammatory response, the bone begins to separate and becomes colonized. Ceramics like zirconium, they don't stick immediately, but over time, the fibroblasts that attach to them. Fibroblasts don't attach to titanium. There's never a connection. So there will always be an inflammatory gum and bone and acid changes, and a change in the microbiome. You get burning tongue, depression, hypothyroidism. First 3 days after extraction and cleansing with ozone and PRF, she had great increase in energy and her tongue, everything resolved.
Doctor, we have 2 more minutes.
Okay, biotoxicity. We won't go into it, I guess. Here. We won't go into it. I guess we're going to have to skip all this stuff. Here's the fatty degeneration, osteonecrosis, ischemic bone disease. Now, there's the International Academy of Oral Medicine and Toxicology. This is the answer, okay? Dentists, physicians, allied researchers. They exist, okay? They teach smart, safe mercury amalgam removal technique. You should see what they do, because you can't just drill it. Anyway, we've got to get them there, okay? They get accredited. Clinical nutrition, heavy metal detox, biocompatibility, sleep disorders, floor. Yes, real dentist, okay? Now, edentulosum and dementia. This is, the World Health Organization sees this as a disability. Why? Because you no longer can eat and speak. Yeah, so that's kind of a big problem, all right? The association between edentulism and dementia, 100%. Okay, can't get into it, but anyway. Here's India. Here's what we see in India. This is okay, and it's due to what? Lack of awareness. They don't know about poor oral hygiene, consuming, so edentulism. That means all teeth loss, up to 34%. The Indian government says this is a problem. Okay. The number of teeth lost in India by the time you're 60, the average is 12. Every tooth loss increases the risk of dementia. By the age of 60 in India, the average Indian has lost 12 teeth. Anyway, this guy here had all kinds of problems. TED, blood pressure, insomnia. Anyway, high heart rate. This is all the testing they do. Anyway, she found root canals here. She found this. She found this. She found this. She found this. This is what it looked like. Oral infection, gangrene, very low vitamin D, probable hypothyroid. This is what she did. ANS imbalance, dysbiosis. Okay, all these things. Plan was she gave vitamin D and iodine. Eradicated infection, removed dead parts, reestablished blood flow, support nutrition and digestion, replaced toxic materials with biocompatible restorations, put in zirconium implants, nutrition, yeah, and he enjoyed his retirement. These are what they use. They use ozone, laser, microcurrents, trigger point injections, neurotherapy, prolotherapy with PRF, biomodulator, PMF, all the things we think about in holistic medicine, they do. Applied kinesiology, nerve essential oils, homeopathy. This is what they do in that. Let me show you here. He was happy. Anyway, I can't go into it. I guess I'm losing time. But here's what Dr. Emma does. See, titanium has aluminum, chromium, nickel, cobalt. Gold, only 30%, the rest is heavy metals. Okay, this is the work she does. So we use ozone. What does ozone do? Ozone, instead of chemicals, actually is 100,000 times more bacterial microcidal than chlorine. That's why the Olympic pools use it. The Olympic pools use ozone, not chlorine. Okay, it accelerates wound healing. It increases 2,3 DPG, so you have more oxygen delivery. It modulates cytokines. What? It's anti-inflammatory. It improves the detox potential. That's what ozone does, all right? Then they also use low-level laser, red therapy, specific microcurrents, alpha stim, grounding mats, trigger point injections, prolotherapy, proper breathing. Here's here's neurotherapy, red light therapy, alpha stim, grounding mats. This is a dentist, not a doctor, a dentist doing this, okay? You want a dentist as a partner like this, right? Nasal ozone, breathing. Prolozone is procaine, anti-inflammatory medications, homeopathics. That's what they inject right into there for TMJ. Yes, 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 yes. All right, ozone-assisted gentle whitening. Right, this is Dr. Emma. Snoring. She gives everybody a watch. They wear it overnight. She looks at their sleep things. And she's finding out people have sleep apnea. She fixes it. Laser treatment, because they had what they call tongue tie. Yeah, you don't have to go to an ENT and get it right there in her office. If you want any references, so let's put the mouth back where it belongs, in the body. Thank you. I hope I made it in time.
Yes, absolutely. And your session was really an eye-opener. And there's so many questions in the chat people have been asking. So what do we use in our toothpaste? Where do we find the right product? And so on. So thank you, Dr. Thomas. It was really, really amazing.
Can I let me say one thing about oral hygiene?
Yeah.
Okay. Just do this. Let me just give you a real brief one, okay? Because it's important, okay? We can discuss it some other time. Okay. In the morning when you wake up, don't brush your teeth. Go in there, get some salt, a little bit of salt in water, and rinse, because that'll go up under the gums. Rinse it all off and spit it out. Don't drink water first. Spit it out, because what you've got in there is all kinds of stuff that grew overnight. Do that. Then you can brush your teeth. But before you brush your teeth, you're going to take some coconut oil, and you're going to put it in your mouth, and you're going to do oil pulling for 20 minutes. So while you're doing that, you can go take a shower, you can make your tea, whatever you're going to do, and then you spit that out, not in the drain, in the garbage, because it'll clog up the drain. Now you can you don't even have to brush your teeth. It's irrelevant at this point. You do that. Now throughout the day, what you do is bring a little bit of salt with you and rinse your mouth a few times a day, real hard, and gargle, and just get those out. That's going to eliminate the periodontal problem as well as the cavitation. So you do that, and then at night you can do the same. Now what I do is I have a 6% food grade hydrogen peroxide. I take a squirt of that, and I do that in the morning and night. You won't have periodontal conditions. You won't. You're gonna be healthy. It's very, very important. And then the other thing is start eating human food, and we'll talk about what that is later.
Yes, absolutely. So I have one question here if you would like to answer this. Can you suggest ideal probiotics for chromogenic bacterial strains caused by sulfur-producing bacterial strains like Pribotella and actinomyces?
Well, you know what? It's the sound is really difficult. Can you say that again, please?
So ideal probiotics for chromogenic bacterial strains caused by sulfur-producing bacterial strains.
Right. So is the question about what probiotics to take? Yeah. Okay. So here's the thing about probiotics. First of all, we've got to have multiple species. So I look for products that have about 40 different species, because it's like if you were going to go, you and a group of people wanted to go have your own separate ecosystem. You'd have to have a carpenter. You'd have to have at least one farmer. One teacher, one chef. You have to have all that to have a good ecosystem. The same with them. So they need all these guys to form an ecosystem. If they don't have all the supporting, then they won't be able to colonize. So you want to have a probiotic that's got a lot of different species, at least 40, right? And the other thing, and you want to make sure you have Bifidobacter bifidus. You got to have Bifidobacter bifidus in there, okay? You're not going to get Akkermansia, so you have to take that separately. We need Akkermansia to heal our gut. Now, the other thing is this. Remember, if you've got ants in your house, why do you have ants in your house? They found something to eat. Okay, you will not, if there's ever any organism anywhere, it's there because it found something to eat. Okay, and if all I have is fruit and vegetables, you won't find any bobcats coming in my house. You won't find any lions, right? That's not their food. In other words, it's what we eat that will determine our microbiome, because all the studies look at prebiotics as being much more effective than probiotics, because the prebiotic is the food for the probiotics. But if you're eating human food, so whatever you eat, for example, if I'm eating a fast food diet, the relative proportion of microorganisms in my body will be those that like fast food, and those are not compatible with my health. Now I start eating home-cooked meals. It changes. Now I start eating vegetarian. It changes. Now I start eating raw. And guess what? Now I have the microbiome that is in support of my health. I don't have to take any probiotics because they'll be there. And if I take, even if I take the right probiotics, but I'm eating the different food, they won't have anything to eat and they'll just pass through. They won't be able to colonize. So the most important thing is what we eat, right? And then the other one is this. The Bifidobacter bifidus, which we need in our colon, we never know if it arrives there. So one of the other things that I do, especially because I have people who are very sick, is we get a probiotic in a powder form that has a lot of Bifidobacter in it. We mix it with some water. We take a syringe, suck it up, and then I get a Foley catheter, cut it off, and have it about this long on the syringe. And they lay down at night, and before they go to sleep, they suck it up, put it up, they put it into their rectum, they inject it, they leave the Foley there, they take it out, they pull up some water, because remember, a lot of those will be stuck in that Foley, and they squirt it through, and now they go to sleep and they lie horizontal. Every hour there's a new generation. So by morning, even if they sleep only 3 hours, 4 hours, they're gonna be able to colonize their colon. Very, very important, okay? And remember, for women, the vaginal flora is very similar to, it's real close to the GI system, okay? The other thing is, if a woman goes through menopause, remember, you go through menopause, you're not gonna have estrogen, the vaginal tissues will become dry, and you're gonna have a different microflora. So you wanna use bioidentical vaginal estriol to restore the integrity of the vaginal tissues, and they'll be moist, and you'll be able to have a good biome in there, vaginal biome. We have vaginal biome, nasal biome, 9 different microbiomes in our mouth. I mean, 44 species on our forearm. They're not germs. They're not germs.
Thank you. I mean, you really explained it in a very simple way. One last question. You spoke about epithelon. Does that have anti-cancer properties?
As a matter of fact, there's an association between if your telomeres are long, you have a less risk of cancers. So what the studies have shown, there's a Russian scientist was a guy that discovered this peptide, and I called him. I found him. I don't know how I found him, but I found him, and I said, okay, so you do this twice a year. I got it. And is there how long can you do it? He said, well, when I first discovered it back in the 80s, I started my mother on it, and she was 60 at that time. Okay, she's now in her late 80s. She looks the same. So in other words, keep doing it. So yes, twice a year, epithelon, and it's like a 10-day injection. You know, and you're using insulin syringes, a small amount, but yes, it has. So what I use, the 4 peptides I use for people that have cancer: thymosin alpha 1, methionine and kephalin, GHK, and epithelon. Those are the 4 I use for people who have cancer. And guess what? If you don't want to get cancer, do the same thing.
And how about its function in a spray form?
Well, yeah. So if the molecules are small enough, you can use it in the spray form. So we have Cmax, C-Lank, PT141, and epithelon. What do we have? I got to see. I don't know, but that's a good idea because epithalon is what? Only 3 amino acids. It's very, very small. So I'm sure we can have it. We've got to get it. But that's a good idea. If we don't have it, I'm going to have them make it. Good idea.
We currently get it. I mean, we've made it available in India. I mean, we get it from abroad, and we have it available here.
The epithalon spray.
Yes, yes.
Excellent, excellent. Oh, wow. Um, Good. Do you have a C-Max and C-Link spray? Nasal sprays?
Yes. So those are nasal drops.
Right, right. Because you can use, for traumatic brain injury, Alzheimer's, senility, all those things, right? Yeah.
So great. Thank you, doctor. It was really a very informative and amazing session. We look forward to more sessions from you, more information. We are hungry for this. So thank you so much for your time.
No, you're welcome. I love this group because I know you guys all hear it, and you know, what good is a teacher without a student, right? And plus, you guys know so much more than I do, so it's got to be both ways. So let's, I want to be part of this and I want to learn from you all too. But I have a lot to share and I want to share it. But I do want to bring biological dentistry to India because 95% have periodontal. That's not okay because that leads to tooth loss. So we got to do something. So you all need to work with me. We've got to find dentists. We'll set up a training program and let's get this happening.
Sure, absolutely. We will do that. Thank you so much.
Okay, namaste.